In 1922, the world was changing. The industrial age had taken root, and the American economic engine was firing on all cylinders. Skyscrapers began to fill cityscapes, and America's baseball team, the Yankees, was finally building their first stadium in the Bronx. The nation was on the rise, but so too was something else. A contagious and sometimes deadly disease that was paralyzing hundreds of thousands of children. Polio. And in 1922, it was an epidemic. That's when a group of dedicated men decided that something needed to be done to help children and families. Shriners, like you, made it their mission to establish a healthcare system that could help children affected by polio, and Shriners Hospitals for Children was born. Today, polio is under control, but in temples and towns all over the globe, the mission to help kids continues. Shriners give their time, talent, and resources to support the ever-changing mission of Shriners Hospitals for Children. We have grown into one of the largest pediatric specialty healthcare systems in the world, providing advanced care for children with orthopedic conditions, burns, spinal cord injuries, and cleft lip and palate. Every day, it is the hard work and dedication of the Shriners that inspires an entire healthcare system to be pioneers in research and medical modernization. In fact, innovations in treatment practices first discovered and performed at Shriners Hospitals for Children are now standard procedures around the world. World-class research and medical education continues to define us as a leader in modern pediatric care. Outreach efforts have expanded to 120 clinics in 18 countries, extending Shriners Hospitals care beyond the walls of our hospitals and into rural communities and places where specialty healthcare may be inaccessible. Physicians and nurses provide convenient, permanent, and portable access to specialty healthcare services to kids who may have otherwise gone untreated. Other teams are impacting children across the globe, kids who have almost no access to healthcare, let alone specialty healthcare. It is this limitless approach to providing care outside the hospital walls that gives Shriners Hospitals for Children the ability to respond in times of crisis. Recently, when tragedy struck children in Taiwan, Mexico City, and Guatemala, it was fast-acting Shriners who offered the assistance and the expertise in life-saving burn care from the doctors at Shriners Hospitals that helped these children in crisis. This rapid response has earned us a reputation as a global force for kids. Technology is also playing a role in the future of Shriners Hospitals for Children, and we are embracing it. A new network of telehealth centers are coming online. These centers allow doctors and nurses to speak to, examine, and treat patients in remote parts of the United States and overseas, expanding access to healthcare for those that need it most, allowing Shriners Hospitals to come directly to the patient to ease the burden of long-distance travel. Very soon, Shriners Hospitals for Children will be the largest pediatric telehealth network in the world. Over the years, we have developed professional affiliations and partnerships with other world-class medical universities, facilities, and global health organizations. You may not know that Shriners Hospitals for Children has treated children from virtually every country in the world. In 2016 alone, Shriners Hospitals treated children from 168 different countries. In North America, the Shriners Hospitals for Children healthcare system is known for pioneering pediatric burn care. We maintain the largest network of pediatric orthopedic surgeons and developed the first model for spinal cord injury rehabilitation designed for children. Our network of motion analysis centers and low-dose radiation X-ray equipment is the largest in the world. New outpatient services and other treatment improvements are being implemented every day, making our network an ever-evolving, compassionate place for world-class pediatric care. All of this is possible because of Shriners just like you and the proud history you represent. Just as in 1922, when polio demanded a change to pediatric care, you made Shriners Hospitals for Children possible. And as the pediatric medical landscape has changed, Shriners have ensured to evolve Shriners Hospitals to meet the challenge. Because what mattered to us then still matters to us today, remaining an innovative, ever-evolving organization that compassionately helps as many children as possible, regardless of their family's ability to pay. Children like Alec.
From the bottom of my heart, thank you for being a Shriner, and thank you for making a difference.
But there are more children, just like Alec, that need us.